Work in immunotherapy wins the Nobel Prize. Physician-run ACOs bring savings for Medicare. And the struggle to limit antibiotics starts with patients. Welcome to This Week in Managed Care. I'm Laura Jost. This year's Nobel Prize in Medicine went to two pioneers who made the basic discoveries behind checkpoint inhibitors, which have offered an entirely new way to treat cancer. Doctors James Allison of MD Anderson Cancer Center and Tasuku Honjo of Kyoto University will share the $1 million prize for work performed in the 1990s. Allison discovered that blocking the CTLA-4 protein could boost T-cell responses, and he did the first experiments with mice to show that this mechanism could shrink tumors. He developed ipilimumab, which is sold as Yervoy by Bristol Myers Squibb. Honjo's team worked separately to understand the mechanism to block the PD-1 protein, which was developed into nivolumab or Opdivo by BMS and pembrolizumab or Keytruda by Merck. AJMC was on hand in New York City when Allison appeared at the International Immunotherapy meeting on the day of the announcement, where he talked about the uncertainty of science. He said, "How do you know what's going to be relevant or not? I think you should pick your problem, work on it, do the best work you can." Accountable care organizations led by physicians save more money than those organized by hospitals, and the benefits for Medicare have grown in the past 3 years, according to a new study. Research in the New England Journal of Medicine, which was based on claims data from 2009 to 2015, found that physician-led ACOs had more reductions in spending per Medicare beneficiary than hospital ACOs, and the reductions were greater as the ACOs gained experience. The authors, who include AJMC co-editor-in-chief Dr. Michael Chernew, say recent CMS calls to push ACOs to adopt downside risk on a faster timeline could be counterproductive. They wrote, "Our results also suggest that shared savings contracts that do not impose a downside risk of financial losses for spending above benchmarks, which may appeal to smaller organizations without sufficient reserves to withstand potential losses, may be effective in lowering Medicare spending." Patients who receive an antibiotic are happiest with their doctor's visit, whether or not they need the drug. A study reported in JAMA found that concern about patient satisfaction scores may influence doctors to prescribe antibiotics even when they are not necessary. The study looked at more than 8,300 appointments for respiratory tract infections and found that 66% received antibiotics for a condition that rarely calls for one. Routine overprescribing of these drugs can lead to antibiotic resistance. Between 40 and 75% of American women have experienced sexual harassment in the workplace, and 36% of women have experienced sexual assault, and they experience health issues as a result, according to research published this week in JAMA. More women are acknowledging the problem as attention has turned to sexual assault allegations against Supreme Court nominee Judge Brett Kavanaugh. The first study of women aged 40 to 60 found the following. 19% had a history of workplace harassment, 22% had a history of sexual assault, 10% had a history of both harassment and assault, a history of harassment was associated with hypertension, and a history of sexual assault was linked to depression and poor sleep. A separate letter about sexual harassment in the medical field in Germany found that 70% reported some form of misconduct, and women reported that the harassers were 85% male, though fewer men reported the same. Finally, the current issue of evidence-based diabetes management is available, featuring coverage on the topic of diabetes education and payment reform. Leading off the issue is a commentary from Hope Warshaw, a former president of the American Association of Diabetes Educators, on the need to remodel diabetes self-management education and support. The issue features examples from Livongo and WellDoc and coverage from the recent AADE annual conference in Baltimore, Maryland. For the full issue, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.